Distinguished speakers, ladies and gentlemen, 2020 has been a most challenging year for us all. Individuals, families, businesses, and communities across Europe have suffered immensely. Our citizens saw their lives and livelihoods change overnight. Cyprus has so far been more successful than most in containing the pandemic, and the effort of Cyprus' frontline workers, medical staff, and citizens should be acknowledged and praised. But Cyprus has not been spared completely. The recent sharp increases in daily cases far exceed what we saw in the spring. A stark reminder that all of our communities are vulnerable to this virus. COVID-19 has taught us some harsh lessons. It has reminded us of the foundational importance of our health, a prerequisite for resilient, equal, and sustainable communities. The pandemic has shown us how fragile our societies are and how easily they can be upended. And it has also reminded us of the value of collaboration and unity of purpose. So I'm truly delighted to join today's important summit, which champions solidarity and which will explore the different paths to stronger, fairer, and more prosperous societies for us all. This unprecedented pandemic has exacerbated many of the structural weaknesses in our healthcare systems. In doing so, it has pointed out what we need to improve and how. For example, during the first wave, precautionary measures in some member states led to export restrictions, inflated demand projections, and unnecessary stockpiling of medicines. Equally so, we had to face medicine export bans from third countries. Solidarity, tireless efforts, and focused cooperation were and still are of utmost importance to combat this virus, as it became obvious from the very start that we could never defeat it by working alone. From day one of this pandemic, the Commission has called for coordination and unity of purpose, being well aware that it is the most effective path forward. I am very pleased Cyprus has been fully engaged in all of the EU's coordination and cooperation mechanisms from the outset. I know that my Cypriot compatriots have made a lot of sacrifices all this time. That is why it is so important to continue our social distancing measures and personal hygiene in order not to jeopardize all those hard efforts until a safe vaccine is developed. Shortages of medicines and medical equipment is an area where collaboration is especially important, and the Commission has taken steps to enhance this cooperation. The EU Executive Steering Group on Shortages of Medicines has been collecting data and sharing experiences and insight between member states. In parallel, the European Medicines Agency has established an important communication channel with the pharmaceutical industry, improving visibility and early identification of vulnerabilities in the medicine supply chain. We launched 7 joint procurement calls for essential medicines and equipment, like ventilators, ICU medicines, and rapid antigen tests. And the Commission has also worked to develop more evidence-based and common approaches to testing, quarantine, and travel restrictions. But this is not just a health crisis. COVID-19 is having a far-reaching impact across our societies as a whole. In response, the Commission is mobilizing all the means at its disposal to support member states in tackling the pandemic in all its forms. To aid member states protect their citizens and mitigate the severe socio-economic impacts, the EU adopted a new instrument for temporary support to mitigate unemployment risks in an emergency. SURE. Out of a total envelope of €100 billion, €87.9 billion have already been allocated, and financial assistance is currently being dispersed. Under SURE, Cyprus will receive low-interest rate loans amounting to €479 million. This will help Cyprus to support employees and the self-employed, and will guarantee income support to those that have to abstain from work for health reasons due to the COVID-19 pandemic. I am indeed very pleased to note that Cyprus already received last week €250 million. Ladies and gentlemen, the pandemic has pushed us to improve our preparedness and response capacities. EU citizens rightfully expect to be protected, and we are determined to do so. The European Health Union package announced on 11th November will help us to live up to those expectations. It is a major step towards a more secure, a better prepared, and a more resilient EU. This package reinforces the most important roles of the European Centre for Disease Prevention and Control and the European Medicines Agency. And it will create a dedicated European Health Emergency Preparedness and Response Authority to strengthen our ability to deal with new and emerging cross-border health threats. These measures will be complemented by the Pharmaceutical Strategy for Europe, which will be announced and will address longer-term structural challenges. But Member States have a major role to play in this effort too. The European semester's country-specific recommendations, which we issued in May, will help to guide this work. And, for the first time, all Member States received recommendations concerning their health systems. In the case of Cyprus, the Commission called for strengthening the resilience and capacity of the health system, including by improving health professionals' working conditions. With instruments available in the next multi-annual financial framework, including the substantial new standalone EU for Health programme, the Commission is determined to support Cyprus's efforts to strengthen its health system and promote the health of all its citizens. Vaccination offers the surest exit from the pandemic, but it needs to be underpinned by effective partnerships. The EU strategy for COVID-19 vaccines recognizes the need for safe, effective vaccines, and it is also a strong example of the power of solidarity. The strategy has helped us to accelerate the development, manufacturing, and deployment of vaccines against COVID-19. It will ensure fair and equitable access for all across the EU and globally. We have signed contracts with 5 companies and are in discussion with others. And these agreements seek to ensure that all member states get access to high-quality vaccines at the best possible terms and conditions. Speed is important, and we cannot leave anyone behind in this effort. But, at the same time, we will not compromise on safety. Flexibility in the EU's regulatory framework allows the development, authorization, and availability of vaccines to be accelerated, while maintaining very strict standards for quality, safety, and efficacy. And the European Medicines Agency has introduced rapid review procedures to quickly deliver the assessments of vaccine applications. Vaccination is not the magic wand that will make COVID-19 disappear, but it is a vital part of our exit strategy. Ladies and gentlemen, we are responding to an unprecedented crisis, and we are trying to improve our long-term preparedness at the same time. It is like building a ship while sailing in it, in the middle of a storm. But we are not sailing blind. We are guided by science and buoyed by solidarity, collaboration, and unity of purpose. We are guided by determination to shield our citizens on possible future crises in the area of public health. This is the EU at its best times, of crisis, of pooling resources, of sharing expertise and cooperating in an unprecedented way to bring tangible benefits to the everyday lives of its citizens. Because every life matters. Because everyone deserves a safe and prosperous future. Now I wish you an insightful, forward-looking discussion. Thank you.